Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 1. Pathology. Let's get started with question number 1. For the following case, which of the following is most likely to be dysfunctional in this patient? A. C1 complement component. B. Chloride channels. C. Dynein arms. D. Interleukin-2 receptors. E. Immunoglobulin gene rearrangement. F. NADPH oxidase. The case scenario is: a 4-year-old boy is brought to the emergency department for difficulty breathing and a productive cough. He has a past medical history of recurrent episodes of sinusitis and otitis media. The respiratory infections typically have a protracted course but respond to high-dose antibiotic therapy. Pulmonary auscultation shows crackles and wheezing. Cardiovascular examination shows a cardiac point of maximal impulse that is palpated at the right fifth intercostal space. The question is: which of the following is most likely to be dysfunctional in this patient? Your options are: A. C1 complement component. B. Chloride channels. C. Dynein arms. D. Interleukin-2 receptors. E. Immunoglobulin gene rearrangement. F. NADPH oxidase. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is C, which is Dynein arms. This question is designed with the focus to assess your ability to apply foundational science concepts. This patient's history of recurrent respiratory infections and dextrocardia on physical examination are suggestive of kartagener syndrome, a form of primary ciliary dyskinesia. This autosomal recessive condition is caused by a wide variety of mutations that impair ciliary structure or function. Eukaryotic flagella and cilia are composed of a central core known as the axoneme that is surrounded by cell membrane. The axoneme of flagella and motile cilia consists of a circular array of microtubule doublets surrounding two central microtubules, 9+2 arrangement. The axoneme is anchored to the cell by a basal body. Each doublet has an A and B subunit and is connected to the adjacent doublet via Dynein arms. These Dynein arms contain an ADPase that generates energy to slide the microtubules past each other, producing ciliary movement. Primary ciliary dyskinesia can result from failure of the Dynein arms to develop normally. Patients with primary ciliary dyskinesia experience recurrent respiratory infections, example, chronic sinusitis, bronchiectasis, as a result of impaired mucociliary clearance. In addition, impaired ciliary movement during embryogenesis can cause situs inversus, reversed right or left positioning of internal organs. Infertility in men, impaired sperm motility, and women, immobility of fallopian tube cilia, is another frequent manifestation. If you choose any option other than C, you are wrong. Let's briefly discuss the other options. A. C1 complement component. Deficiency of the C1 complement component causes increased susceptibility to encapsulated bacteria, example Streptococcus pneumoniae, Haemophilus influenza, Neisseria meningitidis, and also predisposes to developing systemic lupus erythematosus. B. Chloride channels. Epithelial cell chloride channels are defective in cystic fibrosis. Although patients with cystic fibrosis typically have recurrent respiratory infections and infertility, dextrocardia or situs inversus are not seen. D. Interleukin-2 receptor. Defects in T-cell interleukin-2 receptors can cause severe combined immunodeficiency disease. E. Immunoglobulin gene rearrangement. Immunoglobulin gene rearrangement is impaired in hyper-IgM syndrome. In this disorder, B cells produce high amounts of IgM but are unable to switch production to other immunoglobulin classes. F. NADPH oxidase. NADPH oxidase deficiency causes chronic granulomatous disease. Your take-home message from this question is that kartagener syndrome is a form of primary ciliary dyskinesia characterized by the triad of situs inversus, chronic sinusitis, and bronchiectasis. Occurs due to mutations that impair the structure or function of cilia. Cystic fibrosis also causes chronic respiratory infections, but it is not associated with situs inversus. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. However, should you fail to answer correctly, it is imperative that you watch this episode again. Remember, understanding is key to progress. Unlock the secret to acing your medical exams, especially the USMLE, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.